The governor of Wisconsin declaring a new public health emergency as the state sees a surge in cases among young people. NBC News medical contributor Dr. Kavita Patel joins me now. Dr. Patel, the governor there says this increase in cases is especially alarming on college campuses. The Wall Street Journal is reporting on a preliminary study that found college reopenings led to 3,200 additional COVID cases a day. What does this data mean as we are now in the fall? Do colleges need to make some changes?
Yeah, that's absolutely right, Allison. I think it illustrates that colleges, much like the conversations that we've been having about bars and restaurants, just have an environment where people can be pretty closely packed in together. And then when you add on top of that, that some colleges are as big as cities. And so you see a lot of uneven behavior, some people not wearing masks, even when there's a law in place on a campus. And then candidly, what we've learned over the last 6 months with the coronavirus is it's younger people who can easily kind of give and get the virus. They may not get as sick as older people, but they are the ones that are driving increasing numbers of infections. And I would certainly recommend anybody that's going or has been coming from a college campus that they recommend self-isolate, quarantining or some sort of self-isolation to prevent giving the infection to others.
There is some confusion after the CDC posted and then removed guidance about airborne transmission. On CNN today, Dr. Anthony Fauci said airborne transmission could be possible, but then he added this.
But in some respects, Sanjay, it doesn't matter because the things that you want to do to avoid that, make sure there's good ventilation. When you're indoor, keeping the windows open, wearing a mask indoor. When you're outdoor, do all the things I've said. So rather than bending ourselves out of shape, trying to figure out what percentage it is or is not, or how well it's proven, make an assumption that some component of it is aerosol and act accordingly, which means do what we've been telling you to do all along.
What do you make of Dr. Fauci's comments there? Do you agree with him?
Well, I agree with him up to a point, Allison. I agree with him that there is certainly reason to change your behavior. You should still be wearing masks. You should still be outdoors where possible with good ventilation. I think the key here, and I'll just remind viewers that aerosolized particles, the best way to think about them is, remember back in the day when we could go inside department stores and you were near the perfume counter, the closer you were and someone sprayed the perfume, the stronger the smell. But you could still smell that perfume far, far away. That's an aerosolized particle. So I think the piece that's still not clear that Dr. Fauci was correct is that it doesn't change our individual behavior. But I do think that there are implications. If we know that there is a large number of cases coming from these aerosolized particles, the perfume in a department store, that changes the narrative of what I would say is safe to walk into in the winter. I would certainly be thinking twice before I go into a department store, for example, or a crowded post office, even if they keep us 6 feet apart. So I do think there are some implications. And I have heard from people at the CDC that they are going to be posting the kind of final clarifications soon. So we should get some answers.
Yeah, good to know so we can make decisions that we're comfortable with. Again, like you said, you might make a different choice if the transmission is airborne, in fact. One last question for you, Dr. Patel. South Korea reporting a suspected case of someone getting reinfected with COVID-19. If this is in fact the case, and you can get the virus twice, what does that mean for an eventual vaccine?
Yeah, it's too hard to tell. Look, globally, we've had 5 confirmed cases, including this one, of reinfection, one even in the United States, in Nevada. And in all those 5 cases so far, what we have seen is that the second or the reinfection case is not as severe or does not require hospitalization. So that tells us that at least for a vaccine, Allison, 5 cases is not enough to kind of make a broad conclusion. And we do think that a vaccine could give us immunity. The critical question this brings up is how long would a vaccine provide amplified immunity so that you don't get reinfection. And the analogy is what we do every year with the flu shots. This is a reminder, everyone go get your flu shot. It's that time of the year. But we do need to do that because the virus changes and mutates. And so that's not clear if these reinfections are just different strains of the virus, which in some cases they are, or if in fact there's something about the immunity that just kind of goes away. And I do want, I don't want people to get scared, but I do think that reinfections on some level can actually be a good thing. It shows you that your immune system is working to some degree, and that when you get reinfected, it's not as severe. And that's important to take away as well.
Dr. Patel, thank you so much for the reminder about the flu shot, something we need to take care of in our household, and for the reminder of how awful department stores used to be when you couldn't breathe because of all that perfume. I could picture the smell when you brought it up. Oh, my goodness. Thank you so much. What keeps Dr. Anthony Fauci up at night? The fact that some states still haven't gotten COVID under control just weeks before the weather gets cold. Here he is on CNN today.
What worries me the most, is that in those areas of the country, which is a large country, heterogeneous in many ways, if you don't have the control now, as we get towards the end of September, of getting such a low percentage that it is entirely manageable, when things change that work against you, and what works against you now is the fact that we're getting into a weather season where people will be spending more time indoors.
Dr. Uche Blackstock joins us now. She's an emergency medicine physician and the CEO of Advancing Health Equity. Dr. Blackstock, thank you so much for being with us. Dr. Fauci was worried there about what happens when people can no longer be spending as much time outdoors. How critical are the next several weeks in determining what kind of fall and winter outbreaks we are dealing with here in the U.S.?
So the next few weeks are incredibly critical. I can't, underestimate that enough and underemphasize that to people. What we do know is that moving indoors is essentially dangerous with coronavirus, and we're going to see that over the next few weeks. We also need to make sure that people are going to be wearing their masks and still physically distancing. So, in places where the transmission rate is still quite high, we're going to need people to be on extra guard and to enforce those preventive measures.
The UN's Deputy Secretary General told NBC News that COVID-19 could set back women's rights by decades because we are bearing so much of the burden during this pandemic. What are your specific concerns about the impact of COVID-19 on women, and what can we do to possibly correct or improve this situation?
So that's such a great question. What we've seen, we've seen the health consequences of it. I think, more invisible are the consequences relating to gender inequity and inequality. And we're seeing increased rates of domestic abuse. We're also seeing women at home more likely be taking on a higher share of childbearing and household responsibilities. They have been disproportionately impacted in terms of job loss, as well as being able to find new jobs. And so, we think about this pandemic in terms of health consequences, but really it's not. It's more expansive than that. And that this is another reason for us trying to get this virus under control.
Dr. Blackstock, I'm sorry that we didn't have more time to talk to you today, but thank you so much for being with us, and I hope you'll come back.
Thanks for having me.